Sexually transmitted disease, or STD. Here's a table listing STDs and agent causing it. It's all split into bacteria, viral, protozoa, fungal, and parasite. So as you can see on the column on the left, the column on the right is the disease and syndrome, some of the description of the disease. So the one that we're gonna focus on today gonna be Neisseria gonorrhea. So it's gonorrhea caused by Neisseria, obviously chlamydia caused by Chlamydia trachomatis, and then syphilis caused by Treponema pallidum. So the rest of them, you don't need to sort of memorize them, but will be just quickly for your information. You can take a look at that. So virus, so the herpes simplex is mostly herpes simplex virus. 2, so the herpes simplex virus 2 usually associated with the genital tract, and the herpes simplex virus 1 is the one that commonly found in the oral cavity. So this herpes simplex virus 2 is the one that causes genital herpes. Then you have papillomavirus that is causing wart in the genital tract. And then you have cytomegalovirus. This is the one that causing infectious mononucleosis. Infectious mononucleosis is the infection of the throat area, so giving you the swelling and in the airway. So it can be caused by sexual contact. So hepatitis B obviously causes hepatitis, and then causes infection of the genital organ. The reason why some of these are listed because they are transmitted by sexual contact, so thereby the term sexually transmitted. So a lot of terms here that use in the description of the syndrome and so on. At the end of the lecture, there is a table giving you some of the definitions, so you can refer to that. So we by no means be able to cover all the different STDs in one single lecture. So we've chosen the 3 bacteria STD to discuss today. So what are the prevalence of STDs? So in 2016, World Health Organization, or WHO, reported worldwide there are 124 million cases of chlamydia, 31 million cases of gonorrhea, 20 million cases of syphilis. So these are three of the 4 important one that we're going to talk about. We're not going to talk about Trichomonas vaginitis. This is caused by Trichomonas that is listed in the table before this one. So those 4 STD probably the most prevalent or widespread worldwide. In Canada, this is 2017 Public Health Agency data. You can see that chlamydia, gonorrhea, and syphilis. So the syphilis probably the lowest prevalent, but the important is that you can see that 136% increase since 2008. So about 9 years time. That increased by 136%. So the other 2 also have seen an increase in number of cases. So the bottom line is that these sort of disease are not going away. In fact, they are on the rise. Syphilis, particularly, is a good example. This is a STD that had been sort of associated back in the old days when sailors go out to sea for months and they come home with the syphilis, and that spread to their partner, their wives, and that seemed to be under control with the use of penicillin and also prevention or better education, but seem to be on a comeback. So in 2000 last year, that Nova Scotia public health official have declared a provincial outbreak as syphilis. So those are the number, the 82 cases in 2019, up from about 50 cases in 2018 and 38 cases in 2017. Those are a slight increase in cases in Nova Scotia. So the public health official is concerned enough to declare there is an outbreak of syphilis in Nova Scotia. So we're going to start out with gonorrhea. This is a disease that obviously caused by its STD, transmission sexual contact, particularly asymptomatic carrier. That means that person who have been infected but haven't shown any symptoms, so asymptomatic. So they have sexual contact and pass it to the partner. So the organism, obviously Neisseria. Gonorrhea is simply gonococcus, so attach and penetrate the mucosal cell, and then a multiplier enter the epithelial space, and then start the infection. So the attachment is facilitated by pili and capsule. Capsule, you know what they are. There's a carbohydrates layer that found on the surface of bacterial cell. Pili are fimbriae, they're protein in nature, is shown on the diagram, the hair-like structure on the surface of the cells. So also this organism had the features of producing an IgA1 protease, which specifically degrade SIgA. SIgA stands for secretory IgA, which is one of the antibody produced by our body, but secretory IgA are mostly, almost predominantly found on mucous surface, on the mucosal surface. So your genital organ, the mucosal will carry this SIgA, so is the oral cavity of a saliva contain a lot of SIgA. So an organism that colonize this sort of area, they will be faced with this SIgA. So SIgA will basically come and bind to them, prevent them from colonization. So bacteria counter that by producing IgA1 protease. So IgA1 is a specific for IgA1 antibody. They also IgA2. Some of them they also have this IgA2 protease. So being a gram-negative, Neisseria is a gram-negative diprococci, as shown in the picture on the top right there. Is therefore it produces endotoxin like OPS or lipopolysaccharide. So we know that endotoxin is can cause fever, can cause other pathology like shock and so on, high concentration to a person. So those are the kind of virulent factor produced by Neisseria. So if the persistent infection can lead to sterility, that means the person will not able to have children, and the organism at the later stage, even though start off the infection at the genital organ, it can migrate within the body, go to the joints, causing joint destruction, and can also cause blindness in newborn. So meaning that the mother carry that to birth. When the baby come to the birth canal, come in contact with Neisseria and can cause infection of the eye and leading to blindness of the baby. So the symptoms is in male, generally the urethra will be first infected, then you have discharge. So that discharge of pollutant, that means very viscous and contain a lot of body cell, dead white blood cell and other cells from the urethra, and that will discharge. And then you have a symptom called dysuria. Dysuria, painful urination, obviously the infection causing the cell to inflame and swelling, and then cause painful pain in urination. So you can take a little bit of discharge, and you can do a quick stain I show on the top there. You can easily pick out this gonococci, which is the small little dot diprococci, the double two cells together. The larger cells are your body cells, so you can see there's all of a polynuclear cell. They're most likely going to be macrophage or neutrophil kind of white blood cells. So, and then in male, that can lead to a problem with infection other part of the genital organ, like the prostate gland. So, give you the prostatitis, and then you can have the duct that carry the sperm from the testes, that will give you the epididymitis. So some of those terms are defined in at the end of the lecture. There's a table to show that you have question with those, if I forget to explain them. In female, primary site of infection is cervix, so you can also female will have discharge and dysuria, and also complain of abdominal pain. So in ascending genital infection, that can lead to salpingitis. This is the infection of the fallopian tube, where the eggs come down to the vagina, and then ovary can be infected, giving abscess, and then more commonly you have pelvic inflammatory disease, or PID, very common with this gonorrhea at the later stage of the infection. Then your further progression can lead to other part of the body infected, like joint and so on. Diagnosis, basically, based on the symptoms, doctors will make that diagnosis, and also they will collect the discharge or collection of sample, and then send to the lab, and then the microbiology lab in the hospital to do cultivation and isolate the organism, and then we can do the identification they have set up in the hospital. Then for asymptomatic patient, if somebody sort of suspected to have come in contact with that, you still can go and do a test. That basically is to do a sample, and then they will do some more advanced scientific tests like genetic probe test. So the basic genetic probe test, they have a DNA probe that's specific for Neisseria, and then do some testing with that, see whether I will give you a positive results. Treatment, you can use oral cephalosporin. It's a broad spectrum antibiotic, and then chemoprophylaxis for people, for kids who newborn that's born to a mother who have tested positive to the organism. So as soon as the baby was born in the birthing room, you have been in there or you read about it, the baby one of the first thing they do, the nurse will put an ointment or cream into the eye of the newborn, and that cream, the ointment, contain erythromycin, an antibiotic prevent protein synthesis, and silver nitrate, a general heavy metal that will have effect on bacterial cells and other microorganisms. And then tetracycline is again another protein synthesis antibiotic. So that ointment contains 3 active ingredients. It purpose is to prevent the infection of the eye. If mother carry the gonococci. In fact, they do that to all newborns, just preventive purposes. So vaccines are not available. The reason for that is that there are too many different strains of gonococci out there. So making a vaccine that is effective against all the strains a little bit challenging. So they have not been able to come up with a vaccine yet. What's one of the oral aspect of gonorrhea? You can have pharyngeal gonorrhea as primary infection. Primarily mean oral genital infections. So I leave that to your imagination how that can happen. Or can have a manifestation of genital infection. That means that the gonococci have traveled within the body from the genital organ to the oral cavity and causing lesion in the mucosa and sometimes in the throat area. And so if the person have this pharyngeal gonorrhea, you'll notice that they're gonna have sore throat, gingivitis type, very inflamed gum, very bad breath, foul breath, and then the cervical lymph node will be swollen. So these are the common symptoms for pharyngeal gonorrhea. So gonorrhea not only able to be in the genital organ, but also can be in the oral cavity if there are oral genital contact or the manifestation of the disease. So syphilis, the pathogenesis can be sort of divided into 3 stages. So you have the initial primary and the secondary and tertiary stage of syphilis. Initial stage, obviously the beginning when the person first come in contact with the organism. So you will see one or more skin lesion. That lesion is given a special name called tringui. This is a site of penetration at the penis or at the vagina. So lesion will start at the papules, then erode into painless ulcer with raised border. So it's quite easily to identify. So it's not painful at all. Have a border has to raise up a little bit on the outside of the border of the lesion. So that ulcer will actually heal by itself in about 2 months. So person come in contact and start getting a lesion, and then that lesion will heal by itself. And that actually is one of the reasons for the disease or the spread of the disease in the old days, because the lesion sort of go away, and the person who initially contact it think that it's just nothing, is everything fine now, so they don't go seek medical attention. So that contribute to part of the spread in the old days. So during that, when the ulcers disappear, it's actually the organism. This organism didn't go. The spirochete didn't go away. The spirochete is the bacterium that causing the syphilis. So it didn't go away. Rather than it had been sort of disseminate to the other part of the body. So after the lesion heal in the genital organ, you'll start seeing lesion all over the body. So the person also will have some flu-like symptoms, and then start getting the copper red rash on the skin, on the back, on the over the body. So this copper red rash are painless as well. It doesn't have any pain. So in the large amount of spirochete present in this lesion, so the disease then go in another latent stage or clinically inactive stage. So the rash will go away and the person seem to have recovered from it. But that's not the case. The spirochete actually is now going into further into other part of the body, causing a tertiary stage of the disease called destructive stage of the syphilis. This is a deeper tissue and organ affected, that including the heart, including the central nervous system. So this disease go to sort of progressively worsen, and then have a sort of latency in between. So the organism is shown on the picture. There is a spirochete. You see a spiral-shaped organism, and in fact this organism swim like a corkscrew, sort of rotate and going forward. So the proper scientific name of this organism is Tripholema pallidum. This is a cousin of an organism found in the oral cavity. So in the periodontal pocket, where people who have periodontitis, one of the common organisms is called Tripholema denticola. Denticola, Denticola. So denticola. So Tripholema denticola, that is an organism. It's also a spirochete that is found in the periodontal pocket with people who have like 7 or 8 millimeter depth of in periodontitis. So it's an organism associated with highly associated with the cause of periodontitis. So that's causing periodontitis, nothing to do with syphilis. So Tripholema pallidum here that we talk about is the cause of syphilis. So it cannot cause periodontitis. So the two cause different disease, even though they belong to the same group organism that look similar, when they are sort of different species within the same genus. So here's a picture of the showing the corporate rash on the back of the person who has secondary syphilis, and then on the bottom you have the tertiary syphilis. This is a gamma granuloma lesion at the arm. There you can see a rubbery looking lesion, and this can also happen in the oral cavity, even on the hard palate of the oral cavity. So this is just a picture from the arm, but in the oral cavity, in tertiary stage of syphilis can also have this lesion. So on the left here, it just illustrates how the organism can spread to different organs, your liver, your brain, your heart, your bone. So these are later stage of syphilis. Diagnosis basically is quite simple to pick out this organism in sample. So you do a dark field microscopic examination, which is shown on the picture there. So if you use a microscope before, you typically when you look down the microscope, you have a light coming up, that you have your specimen, your cell have color if you stain them. So again, a bright light up background. But dark field microscope, you look down the microscope, you see all dark color, like it's shown in the picture here. But your organism show up as a bright color. So that is dark field microscope. The reason for that is that they use special lenses and setting on the microscope that for dark field microscope. So why this is useful? Because you can easily see the spirochete. You can see the picture, the spiral shape, very easy to pick out. If you use dark field microscope to look at the spirochete. So the same thing. This obviously is the organism causing syphilis. If you want to look at the Treponema denticola from the periodontal pocket, similarly, you can use a dark field microscope to easily pick them out. So you can do the serological testing that one can do to diagnose syphilis. There are two tests out there, one non-treponema test, one a treponema test. The non-treponema test basically they look for two antibodies, IgG and IgM, which you call together they given the name of reagent. That just a fancy name for IgM, IgG together. And these IgG, IgM develop again the lipids released from both the damaged host cell and the spirochete. So when during the infection, your body develop antibody directed against the spirochete and also directed against our own body damaged cell, the lipids. And the test basically is specifically look for those two antibodies. There are two out there. One is a VDRL, one is a RPR test that the basis of it is based on measuring the two antibodies. Then you can also go for a more specific type of treponema test. So it is specific antibody against the spirochete that to confirm the RPR VDRL test. Treatment penicillin is still a very effective antibiotic against syphilis. Obviously, if people who are allergic to penicillin, you can use tetracycline, erythromycin, or chloramphenicol. Those are still very effective antibiotics against the spirochete. So, in general, treatment is not a problem. There are plenty of antibiotics effective. The reason for it to be a problem in the past is that if the person will come in contact like a sailor, go out, come back with the disease, they don't seek medical attention. For one thing, they don't want people to know. Secondly, the latency of the stage of the disease that's sort of not getting them to pay attention to that. So if they seek quick medical treatment under antibiotic treatment, that can prevent the progression of the disease and or the spread of the disease. A vaccine not available, I think that one of the reasons why is that the number of cases is not high enough for big drug company to invest in the money and the time to develop that vaccine. So what are the oral aspects of syphilis? One of them we'll talk about is that you can get lesion in the oral cavity. So the oral maxillofacial manifestation syphilis can occur not only in the tertiary but also in the initial and secondary stage. So the organism had traveled all from oral genital contact and the spirochete start causing lesion in the oral cavity. That can happen in the palatal surface, or could be a mucus patches on the mucosal. Is a mucus patches is generally painless, multiple lesion, grayish white color on the tongue, on the gingiva, on the buccal mucosa. You can see that it is not quite all over the oral cavity. Then in the tertiary stage, then you have the gamma that we talk about, the rubbery lesion, granuloma that can found on the hard palate during the tertiary stage. Now, if mother have that, the children were born with congenital syphilis. If children were born with that syphilis, then they have three symptoms that show up, represent a cell called Hutchinson triad. So that's a famous term for a Hutchinson triad that refer to hypoplasia of the incisor molar and the eighth nerve deafness and also interstitial keratitis. That a fancy name for eye infection. So there are three symptoms associated with congenital syphilis. Here's a picture, one picture about the hypoplasia or the abnormality in the teeth, the incisor. So they are sort of provided by CDC, where we in one of the condition of Hutchinson triad. So they call Hutchinson incisor. We can see the triangular shape teeth. They call it screwdriver looking. So straight edge screwdriver shape. So this is in a molar. Maybe you can see one on the back there. There's a tip over that I think probably due to that hypoplasia formation of the molar. So there's this sort of very easily recognizable formation in oral cavity of the teeth in people who have Hutchinson triad. So the last example is chlamydia. This is caused by the a gram-negative organism called Chlamydia trachomatis. Now, trachomatis it comes from the word trachoma. Trachoma is basically a fancy word for eye infection. So this organism was initially isolated and identified from a child who have eye infection. So they named this organism Chlamydia trachomatis. And it's a gram-negative organism. It's an obligate intracellular bacteria. So obligate means the absolute. They mean they need to be intracellular. So intracellular means they live within host cells. So the life cycle of chlamydia is require them to multiply within a mammalian cells. So they need to go through that step for the whole life cycle. So you cannot just grow chlamydia on agar plate like you grow E. coli, like you grow staphylococcus or streptococcus. So you need to have tissue culture where you have mammalian cells that growing, and then you infect them with chlamydia. So chlamydia infect those cells, go inside those mammalian cells and start to multiply, and then they come out again. So the life cycle requires a step of multiplying inside a mammalian cell, and so we call that obligate intracellular bacteria. So the organism had two developmental forms, called elementary body and reticulate body form. So the elementary body form are the ones that live outside the host cell, that are form the infectious, so they can infect another person. Reticular body form is a pleomorphic form inside the host cell. So pleomorphic means different shape. So the form that live within the host cell multiplying with the host cell is a different shape. We'll call them pleomorphic. So that's a reticulate body form. So pathogenesis of chlamydia is poorly understood. The bacteria probably gain entry or access to the genital organ through abrasion or laceration, meaning that there's some breakage in the mucosa, allowing them to go penetrate the mucosa and get underneath to the deeper tissue to start the infection. So you probably have LPS, being a gram-negative. Other than that, there's not much known about whether any toxin or anything produced by this organism. So it's not like they produce tons of toxin or other kind of surface structure that help them to cause damage or disease that we learn in the pyogenic infection, in group A strep, in staphylococcus, and this organism doesn't do that. But yet it produces damage and infection. People believe that the tissue damage are due to because of the chlamydia live within the host cell. When you have bacteria living in a host cell, they utilize all the energy, resources, nutrients, and then at the end, the host cell will die because you have the bacteria multiplying within them. So lead to cell lysis. So those cells will die and lyse, and break up, and then causing the tissue damage. Here's a picture of the life cycle of chlamydia. So on the left there, you have step one, the EB, that means elementary body form, attached to the receptor on the host cell. Exactly what what receptor they attached to, I don't think they have defined that yet. So they must be recognizing some sort of a surface receptor to bind to it, and then they will be taken inside the cell through endocytosis, the step two there. So one, the inside the cell, they remain in a vesicle. So in this vesicle, now they start to differentiate into RB form, the reticular body form. So, and then the RB form will multiply and replicate, and then giving you many new bacterial cells. Those new bacterial cells will start to mature, and then turning back to the EB form, and then the cell and then release or that lysin. So this new EB form now become in the environment, and then start infecting neighboring cell. So that cycle go on and on. So you can see that giving you some timing there that will take about 40 hours for the whole cycle to go through. So you can actually see that in the electron micrograph, that you can see the different shape and form, or pleomorphic we call it, right? That of this chlamydia within that cell, the vesicle. So you have some very electron dense, darker color one. Then you have some not as dark, bigger, smaller, and so they are different form of the cells within that host cell. So there are several diseases that can caused by chlamydia. So obviously neonatal conjunctivitis, that is your newborn eye infection newborn. So this is acquired by passage to the birth canal for mother who carry that. Then you have urogenital infection, so this is the infection of the genital tract. And then there are lymphogranuloma, Werlinum, so LPV. This is a genital lesion in the lymph node in the groin, and that is quite a severe and ugly-looking lesion that is actually given a special name called Bubor. There's a gruesome picture in the text. You can look at that yourself. So there chlamydia can cause all this eye infection, genital organ infection, and lymph node in the groin area. Diagnosis, basically you isolate this and grow in tissue culture, identify by specific antibodies. Treatment, tetracycline or erythromycin. You cannot use penicillin. Why that is? Because penicillin cannot penetrate the host cell. Remember the life cycle of this organism that live within our body cell. Penicillin cannot get through that our body cell to get to the chlamydia, and that's one reason. The second reason, penicillin will act on the cell wall biosynthesis. Chlamydia do not have a typical cell wall. They do not have peptidoglycan, so they cannot prevent peptidoglycan biosynthesis. Therefore, again, penicillin will have no effect for those two reasons. But you can use tetracycline erythromycin. They can prevent the protein synthesis, and also tetracycline erythromycin is more hydrophobic. They can get to the cell membrane of our body cells. So they also have the ointment that we talked about earlier is also used to prevent chlamydia eye infection. So when the newborn are given this ointment, not only prevent gonorrhea, but also prevent trachoma eye infection. So very good for both. A vaccine not available, but there are people working on it. So like my colleague in IWK, she's working on trying to get a chlamydia vaccine. There are other people in Canada working on that as well. Oral aspect, you can have primary infection. Again, this comes from oral genital contact, and then the cervical lymph node can be affected. So the oral cavity, the cervical lymph node can be infected from oral genital contact, obviously with LPV partner. Early lesion can be on the tongue, and then there are vesicular penis lesion, and one of the hallmark of this chlamydia infection of the oral cavity or the tongue is that the tongue enlargement and forming deep groove in the tongue. So the groove will run alongside the tongue, is not across the tongue. So it is one of the features that can be identified easily. Then in the old days, when dentists do not use glove, then you can have infection of the finger from people who have oral lesion of chlamydia. They can come in contact and get lesion on the finger, but the use of glove in practice have to sort of stop this sort of infection on the finger. So there are a few a couple of chapters in the text that you want to read up more, you can. So the last slide is some terms and some definition that maybe I forgot to mention what they are, but you can refer to that. So that will conclude today's lecture.